I struggled with a bit of a dependency on opioids and cocaine. I was spending up to $3,500 a week on my addiction. It came before rent, it came before food, it came before work.
Hello and welcome to Wellbeing. I'm Jack Hodgins. Today we'll be discussing drug dependence. In the first part, I talk with Ben, who is now sober of an opioid and cocaine addiction. And in the final part of this program, I talk with CEO of the Network of Alcohol and Other Drug Agencies, Robert Stirling. Hello, Ben, and welcome to the program.
G'day, mate. Thanks for having me.
Before we begin, would you mind telling us a little bit about yourself, Ben?
Yeah, mate. I'm a 31-year-old bloke from Sydney. I struggled with a bit of a dependency on opioids and cocaine, and I've just recently got out of rehab, so I'm in recovery at the moment.
When did you first start to notice that drug use was becoming a problem for you?
Probably after I had a few surgeries while I was in the Defence Force, and I was given opioids to treat the pain for that, and it probably spiraled out of control when I was taking time off work and recovering from my surgery.
Would you mind telling us a little bit about your time in the Defence Force?
Mate, I was in the Defence Force for 8 years. Did a couple of tours overseas. Suffered from a bit of PTSD, and there's a big drinking culture within the Defence Force, or my time anyway. And yeah, it sort of just spiraled from there.
How long do you think it took for you to become addicted?
Oh, not long at all. In hindsight, I was probably fooling myself, thinking I wasn't addicted, but I was living a double life, mate. I was fooling absolutely nobody. I was probably hooked from the first time I had it. Looking back now.
What is an opioid?
Opioids are just your pain, it's pretty much synthetic heroin, mate. It's manufactured prescription drugs for pain relief. Anything from Pantene 4 to Endone to your OxyContin. And
from the opioids, is that how you came into contact with cocaine?
No, I was more of a party guy with the drinking scene, and always up for a good time.
Yep.
So I got into that with so it was kind of separate, but it was it sort of went hand in hand with the drinking culture.
Were you peer pressured into kind of taking cocaine and that?
No, I don't think so. I think it was more of my ego and being the guy that had it all the time, and trying to have a good time and make everyone have a good time, and being the funny guy, or it's just that stereotype.
As your addiction worsened, what was going through your mind? Were you actively aware of kind of what was happening?
No, not at all. I was spending up to $3,500 a week on my addiction. It came before rent, it came before food, it came before work. I was going to work, off my head, thinking that no one knew about it, but everyone knew. I wasn't aware how deep I was in, and it cost me my life. I overdosed on my mother's bathroom floor.
Right.
So I got that back to life, and that's how bad addiction is. It takes a hold of you. It's an illness that you don't know about it until you're looking back on it.
What was the moment where you said to yourself that you needed to try and get some help?
I knew I had a problem, but I thought I could handle it myself. Just recently this year, I had another one of those surgeries, and whilst my mother was looking after me, I went 5 weeks cold turkey without taking anything, and I relapsed after 5 weeks, and I had no tolerance in my body to it, and that's how I overdosed. So at that point, I knew I couldn't do it alone, and going to rehab is probably the best thing I've ever done in my life.
How does a drug addiction affect your relationships with other people?
I lost everything, mate. I had a partner for 9 years. Lost that. I lost my house. I lost where I lived. I lost my job. I lost mates. The only thing I didn't lose was my family. They never gave up on me. And they pushed me into the rehab that I went to, Sydney Retreat. So it's now with the program that we work, you try and make amends to the wreckage of your past, and make it up to people. And it's a spiritual awakening sort of process. Realising what you've done and how you've affected people.
Is it hard to first ask for help?
It is, mate. It is. You've got to swallow your pride and, take your ego out of it and realise, you're not alone. And once you have that connection with other people, like-minded people that are suffering the same way you are or have, everything all the wheels just, fall off, and you ready to hand yourself over to get help.
You mentioned some things there, the outcomes of the addiction. What became harder to do with work?
So I was in construction. It was just harder to do my job. It was just harder to maintain, that role that I was in, and it was hard to get out of bed every day.
Okay.
The whole lot, mate.
And I could imagine, I mean, I don't work in construction, but I could imagine that you need to really concentrate on the task at hand. Was concentration affected at all?
Not necessarily. Concentration was affected when you didn't have anything as well. And
Right.
where I was working was a big culture, and, it was very bad. It was very toxic. And I think, you find that a few places like that are the same.
Do you feel like there's a lot of negative stigma in society towards those with drug addictions?
I do, mate. But now being into rehab and having my eyes opened and being aware of how many people it affects and how many, the cross sections of society, that it's every walk of life and it doesn't discriminate. So I think there is a negative stigma, but I think that needs to be lifted. And I think the only way it can be lifted is with the awareness and spreading the message and reaching out for help.
Yeah, absolutely. I guess that's kind of what we're doing right now, spreading awareness. What would you say to somebody who's young and that is maybe at a party and they're being offered, whatever it is, any given substance? What would you say to them before they took that? What would your advice be to them in that moment?
My advice is it's just honestly not worth it. Where will you be in an hour's time? Where will you be, a couple of hours after that? It's just not worth it. Living in the present and living in now and remembering everything better than any drug that you could ever have.
Do you regret taking that first line of cocaine or?
No, I don't regret it because it's made me who I am today. I don't regret my past and I don't want to shut the door on it. But there's a lot of things that could be different without it, and, financially and whatnot. But in hindsight, mate, it's where I am right now in life. I'm quite content and quite happy.
How can family members effectively help someone that's affected by a drug dependence?
They can reach out. There's online. There's a thing called Al-Anon, where they can go onto meetings online, Zoom calls, and talk and just tell their story about how they're affected and seek advice to help their family member who's suffering in the grips of addiction or and so they're not alone with that.
You're listening to Wellbeing, where we are discussing the experiences of living with a drug dependence. My guest today is Ben, who has lived experience with drug dependence with opioids and cocaine. Did your family at all struggle with trying to approach your dependence?
Yeah, I was a miserable mess, mate. I had no outlook for the future, and I was just angry all the time. They were constantly walking on eggshells. I was in denial. I was angry. They couldn't tell me anything until I hit my rock bottom.
What was the process of when you eventually undertook recovery? What is the process like, step by step?
So they throw you into the 12-step program and throw you in heavily with that, and it's all about learning about yourself, learning why you are there, all the resentments you might carry and stuff in your head that people living there rent free or everything. It opens your eyes and makes you see that it's you and your thinking that got you there, and not anyone else's fault. And that's the only way you're going to fix it, is fixing in between your ears, fixing inside your head.
What did you learn about yourself?
I got back in touch with my values and the way I was raised. I lost myself along the way. I was trying to be someone who I wasn't. Being a tough guy and all that sort of things I'd done, all people I'd hurt in my life, and the things I'd lost. It was just materialistic stuff doesn't mean anything to me now, mate. It's all about the connections I have with my peers and my family and friends, and it's all about love.
Do you value those connections a lot more now after the recovery?
Oh, mate, it's the most important thing in my life.
Is the addiction ever really cured, or do you have to have strategies and management strategies going on even years after?
Mate, I'm only new to recovery, but it's never healed. You'll never, my disease is doing push-ups in the background while I'm living life. if you work this program one day at a time and just focus one day at a time, your life will change dramatically.
Are there any specific strategies that you have to get through day to day?
Yeah, mate, I try to keep myself busy. I wake up and I meditate in the morning and I say my prayers and write down what I'm grateful for the day, and I'll attend a meeting every day, or at least one or two, every day on Zoom or in person. You've got a support network around you. You've got the sponsor that I call every day. Just try and keep a good lifestyle and just don't be around or put myself in any situations where I'd be exposed to that lifestyle that I used to live.
Did you ever try and conceal the dependence?
Oh God, yeah. I was fooling absolutely nobody.
Why do you think people turn to drugs?
I think it's the easy way out. It numbs the pain and it numbs, trauma. There's a social stigma on it that it's a good time, and it's not. There's nothing good about it. There's nothing healthy about it. I just think that people aren't educated on how to live life properly.
Did you have a sense of control over your life at all while you had the dependence?
No, my life was unmanageable with my dependence. That my addiction came first and foremost.
Did you have a feeling that you wanted to quit but just couldn't?
Yeah, I became aware of that feeling when I knew I couldn't do it myself. It led me to get very sick and injuring myself, and I was, suicidal. And that's when I realised I was in too deep.
Do you think that society, in its current understanding of addiction, do you think it understands it enough?
No, not at all. I think there's a lot more people affected than we know. And I think, the awareness needs to be, the stigma around it, and everything needs to be lifted and just be accepted that, yes, this is what's going on. And people need help. People really need help. They're not alone.
As someone with lived experience, what are the specific things that you think that society doesn't quite understand about addiction?
That it just doesn't discriminate. They think, the alcoholic's the guy on the park bench in the park, or, the homeless guy, or, that's not what the alcoholic is. Like, I was binge drinking every weekend, just caught up in the party lifestyle, and, it just put fuel on the fire. Everything, turned to shit around it, and, it's just, I didn't recognise myself as an alcoholic until I got into rehab. I thought I just had a problem with drugs, but no, alcohol was a big factor as well.
How should we view drugs? Because it seems as though we've had the war on drugs, but it doesn't seem like it hasn't really yielded many a great outcome. How should a society approach drugs and drug use?
I think purely through lived experience and education. It's up to us as the older generation or the middle generation to teach the kids not to go near these things and stay away from them with the causes, the damage it causes. And I just think that, I think governments need to step in and educate more on these things, because, when I was at school, I definitely wasn't taught enough about it.
How, in your eyes, how prevalent do you think that drug addictions are, or drug use is in Australia?
From what I've seen and where I've lived and whatnot, it's pretty heavy.
What does it feel like to take drugs?
Mate, it feels, at the time you think it's what you feel, you're putting yourself at your mind at ease, and, you're lifting all the pain and getting rid of the demons inside your head and suppressing emotions. But, it's just a never-ending cycle. You might feel good at the time, but you don't see the damage that you're causing to yourself and the people around you. It's just not worth it.
Did cocaine feel different to opioids in any way, or like what?
Yeah, totally different. But one's a bit of known as an upper and one's a downer. And cocaine was more of a social drug in my scene, and it made you always took that when you were partying, and it just snowballed out of hand where it had to be every day, and I couldn't go 5 minutes without something in my system.
Why should someone put in the hard work to get sober?
Because you'll live a life beyond your imagination, beyond your dreams. it's the best thing that's ever happened, and I'm living one day at a time. But I just want to pass on what's been shown to me. I'm not drunk and I'm not dead, and I'm not locked up, and I should be all three. But I just what life has to offer on life's terms is truly unimaginable, and I'm just grateful to be here.
From here, where do you want to go?
And the sky's the limit. I've got a career to focus on. Looking to start a family, make amends with my family, my immediate family, and there's no limit to what we can do with our potential when we're sober.
How can people avoid going down that spiral of drug dependence?
Reaching out. It's not weak to speak. We all suffer in one way or another. We all have. Just don't put yourself in a situation where you're going to be around it to start with. There's a better way. Pick up the phone, ring someone. You're not alone.
And I feel as though in a lot of ways too that the stigma that we have in society kind of gets in the way of that too, and this is why it's so important that we're discussing this right now. And instead of oppressing it, we should be talking about it.
Yeah, you're not wrong, mate. I think, with the laws and everything, just, I don't know how to put it, I think that people should be there should be a hotline or something where, people can reach out if they're struggling. And, there's Lifeline and all that sort of stuff, but they don't take into account drug use or anything like that. I think just where it's total anonymity and, there's no repercussions. I think, with the way the laws are all set up and people are afraid to speak because they'll get in trouble, and, it's just, I think it should be totally different.
On that subject of the laws, with how when someone does come forward or when someone gets caught with drugs, are policymakers, with the laws that they've created, do you think that those laws are helpful in any way towards those that do have drug dependencies?
Nah, not at all. I think, possession and stuff like that, it is a good deterrent, but it's just a lucrative market. People to, divulge in dealing and selling and, that notoriety that comes with it. I think it needs to be, the whole program needs to be flipped on its head.
For those that may be listening today and may be struggling with an addiction right now, any kind of addiction, here now, I think, in talking with you, I think it's become clear that it is possible to overcome that addiction, and to not only overcome it, but to really foster a great life.
Mate, it is the best investment you'll ever make in yourself. It's better than any drug that you could ever imagine. The life I now live, the outlook I have for the future, I'm excited to wake up every day, and, the connection I have with the people around me and closest to me, the people I've met in recovery, they all genuinely want what's best for us. We've been put through the ringer, and we deserve better. And life's worth living, not under the the effects of the mind-altering drug or drinking. It's best to be lived sober. There's no better feeling. There's nothing to hide. There's no shame, guilt, or remorse. And you're just genuinely happy. I haven't felt joy. I don't remember my 20s, mate. And, 10 years of abuse, 11 years, and just waking up each day knowing where I am and what I'm doing, and having the choice to be sober. It really sets you free.
It sounds like life's best lived without drugs. Life is the best drug.
It is, mate. It really is. It's contagious. I wish everyone could feel what I'm feeling right now.
Have you picked up any hobbies or anything, like new interest since recovery?
Mate, I've picked up interest in my fellow sufferers. We call it in the program, it's we call it trudging buddies. We're all walking it together. I picked up interest in that. I'm back into my fishing, back into my motorbike riding, and just things I did when I was younger, and I lost all interest in.
So in a lot of ways, when addiction takes hold, the addiction is it's the only thing that's really being thought of in a way, and it kind of pushes out all the other things that you may have cared of previously.
It really does, mate, and it's the only thing. The first and foremost, you wake up as the first thing you think of. You lie, cheat, and steal to get your way. You become someone you're not. You lose touch of who you really are.
What would be the take home from this interview you'd want people to remember the most?
One thing I remember, you are worth it, and you owe it to yourself to to get better and reach out for help. You're not alone, and it doesn't matter what colour you are, where you're from. It doesn't discriminate, and help is just a phone call away.
Well, thank you for sharing your insight with us today, Ben. We appreciate you taking the time.
No worries at all, mate. Thanks for having me.
You're listening to Wellbeing. That was my first guest for today, Ben, who shared a little bit about his experiences in being addicted to opioids and cocaine. Now I'm speaking with Robert Stirling, CEO of the Network of Alcohol and Other Drug Agencies. Hello, Robert, and welcome to the program.
Good morning. Thanks for having me.
What is the NADA?
So NADA is the Network of Alcohol and Other Drug Agencies. So we are the New South Wales peak body for the non-government alcohol and other drug sector.
And what is the role, in what way does it represent those things?
So as a peak body, I guess as our name implies, Network of Alcohol and Other Drug Agencies, we started off as a network 40 years ago of drug and alcohol services who wanted a united voice to government on their behalf. So we started off as a collective of services who wanted a single point to advocate on key issues impacting on the alcohol and other drug treatment sector.
What are some of the specific organisations that you represent?
Yeah, sure. So, the majority of our members are specialist alcohol and other drug treatment services. So they're providing residential rehabilitation services. They're playing withdrawal management or detox, as most people know it. They provide counselling, structured day programs. But then we also provide support harm reduction services. So services like the medically supervised injecting centre in King's Cross, as some needle and syringe programs. And then we also provide continuing care programs, which are programs that support people after they leave treatment to support them when they're back in the community.
And in a lot of ways, it has network in the name. Does it in some ways connect to other ones? So like it's like is the NADA a pinpoint for people to kind of go to and kind of then go off to all these other kind of organisations?
Look, it can be. we're not a referral source, so we don't have people contacting us asking us as a referral pathway to treatment. So New South Wales has an alcohol and drug information service, and that's that central point that refers people in the community if they're concerned about their substance use or if they're concerned about a loved one's substance use. That's the number that they would call. So really what we do is I talked about the advocacy, but another key thing that we do is capacity building and workforce development to make sure that the services that we represent are providing the best quality treatment and care to people with substance use issues.
Yeah, in this sector, there also seems to be a lot of stigma towards those that have problems with alcohol and drug use. Where are we at in society with that, do you think?
Look, actually, we just put out our quarterly issue is actually on stigma and discrimination. So I encourage your listeners, viewers, to check it out. And really interesting, I think there is a National Household Drug Survey that has seen a change in community perceptions of people who use drugs. And I think we are starting to look at reducing stigma and discrimination for people who use substances. I know in the mental health sector, there's been a lot of work, a lot of investment done to try and reduce stigma and discrimination to people with mental health issues. But in drug and alcohol, we have so much more to go. Particularly, people who inject drugs, they're one of the most stigmatized groups, I would say. And so that impact of stigma and discrimination on people has this flow-on effect on the families of people who have substance use issues. And something that I just talked about in that article was that I think we also see the results of that on the workforce as well. So for people who are working, supporting people who use substance use, so those incidental conversations they might have with the taxi driver, and language that, hearing stigmatizing language like junkie and those type of things, which isn't very helpful. So I think that the impact of stigma and discrimination is on the workforce, but the other thing that I think it impacts on is actually policy and funding. So New South Wales, there was a special commission of inquiry into the drug ice, which the commissioner handed down the recommendations over 2 years, and the New South Wales government still hasn't actually responded to that. And of course, we totally appreciate that COVID, came in at that time, and we absolutely applaud the New South Wales government's response to COVID. But I was reflecting on the article that if it was another area of health, do you think that the government would have responded to that special commission report by now if it wasn't about substance use issues? And so what we do see is that we're a poorly funded sector, and we're constantly, I mean, my role as a CEO of NADA is a lot of advocacy to government at both levels of government, because actually drug treatment is funded by the states and territories as well as the Commonwealth. So a lot of my time is spent talking about those issues around not being able to meet demand to support people with substance use issues.
How well do the people in state government and federal government actually understand addiction and in the alcohol and drug field, like when they make policies?
Look, I think at the moment, I think we're in a pretty good position. I mean, I think the state government, the policy area used to be connected with mental health. When I worked in the government, it went through a process of the Centre for Drug and Alcohol and Mental Health coming together. And about 5 or so years ago, they separated. And what we've seen as a result of that is a real commitment from the New South Wales government to prioritise alcohol and other drug responses. And so I think we're seeing some positive change in New South Wales, and we're just really hoping that a whole of government response to the Special Commission is going to be forthcoming. Look, at the national level, we've been really fortunate in Australia to have had very progressive drug policy, certainly from back in the 80s during the HIV crisis. The Australian government was pretty bold under the Bob Hawke administration in terms of introducing NSPs, which has seen really low rates of HIV in Australia compared to injecting drug use in Canada and America, where we've seen really high rates of HIV as a result. But I think that courage has lagged, and I think it would be really great for both the Australian government and the New South Wales government to continue to be courageous and see alcohol and other drug issues as a health issue and invest in that and do really progressive policy.
Would you mind kind of telling us a bit more about how you got involved with this kind of sector?
Yeah, look, I mean, I think, I grew up in Mount Druitt, in Sydney's western suburbs, and, there was a lot of alcohol and other drug use in the community that I grew up in. So I think growing up in that environment of being exposed to people who use substances, I think, and I guess my own experience of using substances within my teens and 20s was kind of a catalyst for when a job came up at the ministry. It was a temporary job, and I just thought, okay, maybe that's something I'm interested in. And so look, a three-month contract has now turned into my career, and I went on to do my Master's of Public Health, and I'm doing my doctorate at the moment looking at measuring performance of drug treatment. And so for me, kind of my experiences growing up has kind of been a bit of a driver to want change.
When did you find the NADA?
I've been at NADA for 13 years now. So I've been in the CEO role for just over a year. But I was in the deputy role for 5 years before that. And I started off as a senior project person doing workforce and capacity building projects. So I've been really fortunate to kind of evolve with the organisation that's evolved as well. So I feel really fortunate with the opportunities that I've been provided at NADA, and working with some really passionate people. It makes going to work every day a pleasure. Even though there's a lot of challenges, that we've talked about, I think, advocating for change really is what drives me and makes me feel good about the work that I do.
Since you first got started, have you seen a change in the sector, a positive change?
Advocacy is slow, movement is slow. There has been some investment in drug and alcohol treatment in the time that I've been there. So, government has definitely invested, but it's been small and definitely not enough to respond to the demand for New South Wales communities that are seeking treatment. But also within the workforce, the professionalisation of the non-government workforce, which, because we are the community sector, we're not medical based, we can often be dismissed as, candles and sandals. We're sitting around holding hands in a group and doing AA and NA meetings. But I mean, I think our sector is so much more than that. And we've really seen this professionalisation and really this capacity to work with clients, to respond to the complexity of clients that are coming in. You talk about the people don't just come to drug and alcohol issues with an alcohol and drug issue. So there's usually a reason that people are accessing treatment. Sometimes there might be coexisting mental health issues. People might be having barriers to accessing housing. They might have come out of the criminal justice system. So the client group that we're working with, and that's a generalization, not everyone comes with those complexities. But when, I talked about my doctorate looking at measuring performance. So when we look at what are the outcomes of drug and alcohol treatment, and I did focus groups with funders, I did focus groups with treatment providers and focus groups with people with lived experience, to say, well, what does the success look like to you? And I can honestly say that it wasn't always just about abstinence from substance use or reduction from harm. A lot of it was around improvements in mental health, improvements in quality of life, having access to housing, being reconnected with family. So the outcomes that are being achieved in drug and alcohol services is so much more than just addressing people's substance use issues.
We spoke a little bit about where the sector needs to improve, but what is it doing really well at this point in time?
We're doing a lot really well at this time. I think responding to the needs of people and making sure people are getting the best available care that they can. I think that's what our sector does well. I mean, we talked about passionate people. Our sector goes above and beyond what they do and what they're paid for. I mean, I think the non-government sector, the pay parity between public and non-government service is much lower in the NGO sector than it is in the public sector. And so I'm always so impressed by the passion of people willing to really go that extra mile to make sure that people are getting the best treatment that they can.
Why is it important that we really work on this sector?
Well, I think it's not just drug and alcohol, it's any sector. I think all health and community services need to be in a process of continuous improvement. I mean, I think that's that cycle of quality and improving and doing better, because people deserve the best quality care, and we're always learning new things. There's always research that is teaching us something new about how to improve the outcomes and the experiences of care for people, as well as the experiences of care for delivering care from the workforce. Because I guess New South Wales looking at this values-based healthcare approach, which I think, being driven by values, I think is great. So I think it's absolutely important for every area of health and social services to continue to reflect on what we're doing and look at how we can do better.
Where would you like to see this sector go, say, in 50 years' time? Where do you think it will be?
The Special Commission that I talked about had 109 recommendations, I think, that were provided, and the Special Commission was a very well-funded commission. They spoke to a lot of people. They spoke to families. They spoke to people with lived experience. They spoke to service providers. They went out to communities. They spoke to Aboriginal communities about what the needs are. It's probably one of the most comprehensive consultation engagement processes that's ever been done. So if we can look at the long-term plan of how we improve responses to alcohol and other drug issues, and do proper workforce planning, we look at reducing stigma and discrimination, then I think, in 50 years' time, we might have a sector that's well-funded, well-resourced. There's a reduction of stigma and discrimination in the community, so that people that need help will get on the phone and call and seek help. So I think that would be a great place to be, Jack.
Well, thank you very much for your time today, Robert.
Pleasure. Thank you so much, Jack.
My two guests today were Ben, someone recovered from cocaine and opioid addiction, and Robert Stirling, CEO of the network of alcohol and other drug agencies. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.